Hello, my health freedom loving friends. Misty Karl Feld here with Health Freedom Idaho, and I'm here with an urgent message. We only have until December 5th to comment, so that means we've got 4 days, and you won't believe what the FDA is trying to do. I'm here with my husband, Dr. Michael Karl Feld, and he's with the Karl Feld Center. He actually saved my life, and he saved my life several times, I think. And it really began with my autoimmune disease that, of course, the Mayo Clinic and everyone else says they don't know what causes my autoimmune disease. It's so rare, we've just never seen it. We just don't know what causes it. But you see mention of it all over vaccine inserts as possible side effect. And that's vasculitis and neuropathy, infection of the nerves. So when I went to the Mayo Clinic, they wanted me to do 3 years of chemotherapy. I instead decided to heal myself naturally, which I'm eternally grateful to my husband for saving my life at that time, because I was bedridden. I was in bed in pain, nerve pain from head to toe, and I had 4 kids and a little toddler to take care of. And, the Johns Hopkins says that in my illness, you live 7 to 10 years. 10 years if you do the 3 years of chemotherapy, which just didn't sound like the 3 years that I wanted to live my life. So in 2015, when I found Dr. Karl Feld, I also found out that in the state, they were trying to pass legislation that would have really handcuffed him. And it was at that time that I thought, I need to have access to natural medicine. My children need access to natural medicine, which is one of the reasons why I started Health Freedom Idaho, to protect our access, meaning protecting our practitioners' ability to practice. And I wanted us to be able to access that natural healing. Well, and especially when we live in this toxic soup, right? We're being bombarded on every level. Cancer is really high, and autoimmune disease is skyrocketing. And these natural substances are helping us. So now the FDA wants to remove these 26 substances. And really it's a bigger picture, but I'll let Dr. Karl Feld speak to that. But some of these ingredients on this 26 that they want to do away with saved my life. They saved my life, and they're saving the lives of other people. And now the FDA wants to remove them, remove our access to them. It's so upsetting to me, and but I'm really grateful that we've created this platform, Health Freedom Idaho, and we have health freedom lovers throughout the nation that we're going to share this video with, because right now, this is the time to use our platforms and do what we can, get loud, because we are the people, and the government is there to represent us, and the people demand that we have these 26 substances, access to them. The government doesn't get to decide what we do or don't do for our health, but they think they're going to get to. So that means we've got to rise up, people. Okay, enough of that. Let's get into, I'm furious. Can you tell? I am furious, because it's not just you and me, it's access for our children. So let's talk about, Dr. Karl Feld, let's talk about in general what it seems, what's kind of overall been happening, because this has been happening for a while, I'm finding out, about 2 years now, right? Mm-hmm. They've been going through this process.
Well, what's going on is that the FDA is holding hearings on these natural substances, and we're talking about substances that we use, people use on a daily basis, like curcumin. Who out there is not familiar with curcumin? If you're dealing with any kind of inflammation, dealing with any kind of pain, and especially now during the opioid crisis that we're dealing with, why would you want to get rid of something that can reduce the amount of pain and reduce the need for opioids and other painkillers? So they've been going through these 300 substances that were then nominated from different organizations, saying that these are substances that we would like to use, and FDA was then categorizing them into 3 different categories. One category was then where they said that this category, these substances, we think that they're good enough for us to hold a hearing. Second category, they said these are not safe enough. They are illegal immediately. And third category, which is the biggest category, they said that this group of substances does not warrant a hearing because there's not enough scientific evidence to support their function. And now we're talking about things like methylcobalamin, like vitamin B12. So you would then lose access to vitamin B12, and this was in the group of substances that did not warrant even a hearing. So you will just automatically lose it. Or things like ginger. I mean, there's a huge amount of research on ginger and its impact on inflammatory components, and it's actually looked upon as almost being more powerful than curcumin in cancer studies. So we are then losing access to these powerful tools. We're losing choices, and it's being done while we are not aware of it. I mean, we're just sitting here thinking that there's somebody out there that's protecting us, and meanwhile our government, FDA, that we think is there to protect us from dangerous drugs, and what they are doing is that they are removing access from safe, natural, effective research substances that are good for us. They're removing that.
Well, no, we're not talking about supplements we're getting at the natural health food store, right? What are we talking about, and as far as these ingredients?
So these are substances, let's say, for instance, in my clinic, we do a lot of nutritional IVs. So you have cancer patients coming in, you have patients coming in with Lyme disease, other infectious diseases, dealing with autoimmune conditions, like my wife, dealing with severe autoimmune condition that incapacitates the individual. So medically, there are very limited options that they have, meaning that they only have drugs that can try to manage the symptoms, but it does not correct really the disease picture in itself. So you would then lose access to like an IV or curcumin, for instance.
Which has really helped me. It really helps my pain and my inflammation. I mean, I've gotten those on a regular basis.
Yes.
A lot of your patients get those on a regular basis.
In fact, every one of my cancer patients gets curcumin IV, just because it is so effective in silencing all these different cancer drivers. And we know that the majority of disease have an inflammatory background. So if we can control that inflammation, we can then support the body's ability to control cancer, control pain, control autoimmune conditions. So by losing access to such a powerful tool, we as natural health practitioners become extremely handicapped.
Yeah. And actually, the first example I had of this, because I thought this could just never happen, that you wouldn't have access to things. The first example of this was when we went to Sweden, when we got married. And we were talking to his family, and they couldn't even get melatonin. They literally could not go to the store and get melatonin. They had to get prescription drugs to help them sleep. In fact, one of his family members came to America and found melatonin and was like, "Oh my gosh, have you ever heard of melatonin? It's the best thing ever. It helps me sleep." He can't get it in Sweden. And Dr. Karl Feld, you have a friend there that can't even give vitamin C IVs to his patients.
No, exactly. So we are taking these rights for granted.
Yeah.
But these rights do not exist in other parts of the world. And you think that a country, we look upon Sweden as being a country where they're forward thinking and they're health minded and so forth. But their access to natural health care is extremely limited. And if we don't stand up, if we don't let our voices be heard, we are going to end up in the same situation.
We're
not going to have these tools that are life-saving for patients.
Do you know that they regulate how much vitamin C they can have? The Swedish government regulates how much vitamin C the citizens of Sweden can have. I don't want to live in a place that I don't have access to my God-given right to have vitamin C. That's not an America that I'm okay with for myself or my children. So you see what's happening? You see how they're toxifying us at every level and then eliminating our access to the supplements, the ingredients that can help get us well? This has got to stop, and it's only going to stop if we rise up.
And the issue is that our environment is getting more and more toxic. Our food is becoming more and more nutritionally void. We are exposed to more
crazy Wi-Fi.
Crazy Wi-Fi. We got mercury, heavy metals, and vaccines, and in our
Microwaves.
environment. I mean, it's insane.
Chemtrails in the air.
Yeah, it's
fluoride
insane.
in the water.
Yeah.
I mean, the list goes on and on about they're toxifying us.
And so it's just amazing that we as human beings are actually able to survive some of that. But then at the same time, by increasing the toxic load around us and decreasing the amount of nutrients available in food, now they're also taking away our tools to be able to support people that cannot handle this stress, which is going to be the majority of us.
Right.
It's
I mean,
insane.
they're trying to, okay? But that's what we have to do is rise up and stop this madness. Stop allowing this to continue, right? So we've put some call to actions in the post here, and tell them, Dr. Karl Feld, what they can do to take immediate action, because we only have until December 5th to be heard.
So we have then 26 substances that are on the chopping block, which means that they've gone through a hearing, and the FDA already said that these substances are not allowed to be used. So the only thing that is left, no, exactly. The only thing that is left is public comment, and that public comment ends December 5th, which means just in a few days. So the only thing behind you losing, or between you losing access to all these agents, is your comment, which means that you need to go and click that link and make a comment and say, I need curcumin because of this, or chondroitin sulfate for another substance that is crucial for your joints, or aloe vera. Let's say if you're dealing with eczema and you need it compounded, an aloe vera substance, and you're going to lose access to that. How dangerous would aloe vera be? Why would that need to be outlawed? Why would curcumin need to be outlawed?
Why would somebody need aloe vera compounded? Can you explain that?
Well, so what happens is that if you would buy, let's say you are sensitive and allergy to a certain ingredient in buy it from the store aloe vera with whatever ingredients, and there's something there that makes that you're allergic to. So then you would go to a compounding pharmacist and say, I need aloe vera, could you please compound it in a way so that I can use it for my skin condition? And or if you need it for healing your gut. Who out there is not dealing with gut inflammation or leaky gut? The majority of us, especially now with all the glyphosates that's tearing our guts apart. So now you have the option to go then to a compounding pharmacist and say, I would need aloe vera. That's the only thing that's going to save my gut, and I can't handle these other ingredients that I get from the health food store, or I get from some other pharmacist that has created. So it becomes crucial. So it's a list of 26 agents or substances that we all need. I mean, like for instance, DIM, D-I-M. Most of you may not be familiar with it, but it is an alternative to break down unwanted estrogen if a woman is dealing with breast cancer or dealing with ovarian cancer. So instead of the hormone blockers, now a woman has a choice, a natural choice. Or boswellia complex is another one like curcumin that is crucial for the anti-inflammatory component. And the DHEA, it's a pro-hormone. Are you dealing with adrenal fatigue? Well, we live in a modern society. Most of us are exhausted. Our adrenals are just overworked. So now you're then pulling away this DHEA substance so that you wouldn't have that available. I mean, it's a list of substances that are proven scientifically beneficial, but the FDA don't care because they have big pharma supporting their activity, and the people sitting at these hearings, they are the head of pharmacy departments at medical schools that are dependent on big pharma money. So are they going to support natural substances? No, they're not.
Well, they don't understand them, and they fear them. I mean, let's be real. They fear them because they actually help people. Okay, so you did an interview with Dr. Paul Anderson.
Yes.
And we have a link to that, so that will get into more details. And then Dr. Paul Anderson also did a presentation. It's about an hour long, but he really goes into the history of how we got here over the last couple of years. And also he talks about a bill, HR, what is it? 1159 or something.
Yeah, I can't
Okay,
remember.
well, it's posted on here, the bill, and he explains how that can help as well. So we need to get our legislators, so here it is, 1959, HR 1959. You need to get a hold of your representatives and let them know to co-sponsor this bill. Get on it, right? We need this bill. And Dr. Paul Anderson does a really great job of explaining why we need it and what it will do, not only for you, but for the practitioners. I really didn't understand until I listened to his presentation how this will even handcuff the practitioners when you need urgent care, when you come in and you need something right away, because it can't be compounded beforehand without some of these ingredients that will be disrupting to your gut or other things. They won't have it for you. They can't have it for you. They can't have it for you. If you walk in and you need it right then, they can't have it for you. So not only does it affect them, it affects their ability to help you. So definitely watch that presentation to understand that bill, what it will do, and why we need it passed. But the urgent right now call to action is to make sure to comment about specifically these 26. But what we understand is there's over 300.
Yeah, there are going to be 300, and we're essentially just going to lose all. I think there's maybe 16 of them that were accepted. I mean, there was a very small number.
Out of almost 80.
Yeah, exactly. So,
and the first on the chopping block was almost 80, and all we got out of that decision-making process was 18.
Yeah. I mean, it's ridiculous, and the ones that we're losing, as I said, powerful substances, and it's gonna handcuff us as naturopathic doctors, as holistic medical doctors that are trying to help you. We are gonna start to look incompetent because we don't get any tools. I mean, it's like, chopping off the legs of a runner and then, tell them to run. These are things that people fly into my clinic from out of the country to receive, and I'm not going to be able to offer it.
Right.
And so, like for
where
instance,
can you go?
Yeah, like for instance, a young woman just did a little testimonial dealing with a cancer spread to lung, brains, liver, bones, and medical profession. They didn't have anything more to offer her, and now she is in remission. The brain tumors disappeared, and this is from using these type of substances to support the body in its own healing process and to normalize physiological functions. So natural substances, just because FDA or the big pharma don't understand them, you as a patient understand your need, and you need to let them know.
Yeah, I understand my need. Everybody who's sick, who has used holistic means to get well, understands the need. When I'm at your center and I see a room full of people getting nutritional IVs, vitamins that help them to get well, help them to get their life back. This young mother that had cancer, she's still able to be a mother right now because of some of these substances. We can't let them just take them away from us. And a good example so that we don't feel totally defeated. What was the...
Kratom?
Yes, Kratom. People rose up and they said, do not take away my Kratom. And they didn't. And it really looked like we were going to lose Kratom on a federal level. And we didn't, because the people rose up, they spoke up, and they did something about it. So don't feel defeated. Don't feel like there's no way to win this, because there is a way to win this. But it looks like it's going to be quite a process. It's not going to be instant, or even just these 26. They're going to keep hammering and keep trying to take away our the substances that heal us. Okay, so we can't grow weary. We've got to keep on and keep on and keep on them. Let them grow weary. Let them get tired of us knocking on their door saying, no, you're not going to take away the substances that heal me. You're not going to put this toxic soup in here, bombard my body with toxins and inflammation, and then take away the things that are going to heal me. Absolutely not. Okay, so please share this video. Please share the calls to action. Do whatever you can. Text it, because you're right, there's shadow banning. And they're not allowing these things to be seen. So it really is up to you. Don't rely on Health Freedom Idaho's page to get the word out. You individually need to message it, text it, email it, get it out whatever way possible. Don't rely on Facebook, because we're only talking to echo chamber we've been talking to for the last year now, since all this attack on freedom of speech on social media. Okay, so it's up to us to get the word out. And it looks like I don't see any questions, but we have the calls to action up there. So get busy, guys. We only have until December 5th.
Yeah, we need a flood.
Get loud.
Yeah, we need to get loud. This is a line in the sand, and we need to draw it right now.
Yeah, absolutely. Okay, get busy.